Good morning to everyone. Today we are going to see about wound healing. Okay, students, by seeing this image, what you are understand actually, the child having a wound in his leg and he is dressing his leg, right? You know why he is dressing? Because to cure his infection or anything is happening in his leg. So that's why we are going to see today. So wound healing is a process by which the skin or any injured organ repair itself after injury. The main of the wound healing is to prevent the limit further damage, to clean and seal the wound against infection, to restore tissue strength and if possible tissue function. So here the two important words is there. That is, first one is called regeneration and second one is called as a replacement. So regeneration is called as a restoration of normal structure and function. So you know what is my replacement? So replacement is nothing but it's a restoration of normal shape into function is impaired or lost. That is a developing a scar. So cell growth we are classifying into three types. The first one is called as a labile cells, second one is called as a stable cells, and third one is called as a permanent cells. So labile cells continue to divide throughout their life. The example is a skin cells. Then stable cells do not divide actively growth, but it will be divide and growth if injured. Example, liver. Then permanent cells have no ability to divide. Example, neurons. So wound healing process. First step, it is a hemostasis. When the wound is occur, the blood will be squeezed out. So first hemostasis is arrest the blood clot, then inflammatory. So inflammatory next followed by the proliferative, then it is a remolding. So phase 1, hemostasis phase. Hemostasis, the first phase of healing begins at the onset of injury and the objective is to stop the bleeding. In this phase, the body activates its emergency repair system, the blood clotting systems, and forms a block the drainage. During this process, platelets come into contact with the collagen, resulting in activation and aggregation. So the thrombin is a center and initiate the formation of fibrin mesh which strengthens the platelets clumps into a clot. You can visualize it in that image. So next one is a defensive, or you may call it as a inflammatory phase. The second phase called as a defensive or inflammatory phase focus on destroying bacteria and removing debris, essentially preparing the wound bed for the growth of new tissue. Then third one, the proliferative phase. So proliferative phase, you having three things, that is a filling the wound, contraction of the wound margins, and covering the wound, that is a epithelialization. So during this first stage, the skin will look like shiny, deep red granulation tissue fills the wound bed with connective tissue and new blood vessels are formed. During contraction, the wound margin contract and pull towards the center for the wound. In third stage, epithelial cell arise from the wound bed and margin begins with the migrate to across the wound.